Okay. All right, Mr. Peterson, I just wanted to go over and educate you about a few things that's going to help, make you feel a little bit more comfortable, and just some things to help prevent this from happening in the future, and also just to maintain the condition that you're in right now. So I know that you said that your lungs, you were in a 3 out of 10 pain in your lungs. Now what's going on is that you do have pneumonia, and you are in acute respiratory distress. So I just want to go over some things that are going to help you feel more comfortable and to kind of help reduce that pain. Now I did administer acetaminophen for you. That is an oral pill, and it's just, it's an NSAID, so it's not going to be powerful, but it is going to take away some of that pain that you are feeling. Also, it is important to cough and deep breathe, and I could teach you some activity or some exercises that will help with that. So the coughing is going to help loosen and I lost my train of thought. It's going to help loosen and get rid of some of those fluid and some of those secretions that are building up in your lungs due to the pneumonia. And some breathing exercises that you could also do is the pursed lip breathing. So what you have to do is you want to take a deep breath in through your nose and then breathe out with your lips. So your lips are going to be pursed like you're kissing somebody. So can you teach me back some of the things that I just talked about to reduce some of that discomfort that you're feeling in your lungs, and also to reduce some of the pain? Oh, can't see me. And to reduce some of the pain that you are feeling. Cough, deep breathe, and pursed lip breathing. Yes. Some other non-pharmacological things that we can talk about. I know I did give you the acetaminophen, but sometimes it helps to do other things to kind of help decrease that anxiety and the discomfort that you're feeling. You could do music therapy, so you could listen to some of your favorite music. Can you tell me what some of your favorite music is? Okay. And then you can also do something that we call guided imagery. So this is just going to help relax your mind. If you close your eyes and think about being on a beach somewhere, it does help kind of reduce some of that discomfort and pain that you are feeling. So if you could tell me what is one of your favorite things that you think about, or places that you've been that you can think about that might make you feel more comfortable or make you feel happy and kind of distract your mind. Hawaii, okay. Alrighty, perfect. And then also it's really important, we want to, since you are in the hospital and you are kind of laying in bed, it's really important that we get up and start walking around, because the more that we do lay in bed, our blood is just, it becomes more stagnant, and we do have an increased risk for getting or forming a blood clot. So one of the things that you can do is you could ambulate, but it is important to press your call bell whenever we do want to walk around and get some exercise, so that we can assist you if you do need help. Also, what was I going to say? Also, when you are performing or walking around or doing range of motion exercises in bed, it's really, really important to not overexert yourself. So to the point where you're feeling really out of breath and it's really tough to breathe and the secretions are really building up. We don't want that to happen, and we don't want this to exacerbate anymore. So when you are walking around, it's really important to take periods of rest between that activity so you can kind of recatch your breath. Can you explain to me what is one thing that's really important to do while you're up and walking around? Take periods of rest, yes. One of the things that's really, really important that I wanted to talk to you about was increasing, is increasing your fluid intake. So what's happening right now is you have a lot of buildup and mucus in your lungs, which is making it really hard for you to breathe, and it's just it's causing you to overexert yourself to try to breathe. So one of the things that we could do to help loosen and break up that fluid is to increase your fluid intake by almost double. So we want to increase your fluid intake to thin out those secretions, so that when you do cough and deep breathe, it's easier to kind of get rid of those secretions. So can you tell me what you need to do to help loosen up those secretions in your lungs? Yep, you need to increase your fluid intake and then cough and deep breathe. One of the major important things that we do need to talk about is talk about smoking cessation. So it's really important that we don't pick smoking back up, because at this point right now your lungs are pretty damaged, and it's causing you to become more susceptible to pneumonia and bronchitis. And you have asthma, and you've had asthma for a while now, and if we start smoking again, it's just going to make everything so much worse. So we don't want that. If you do need any help talking about or getting into smoking cessation, or if you have any other questions about that, I can give you some pamphlets for you to look over. And there's always a lot of resources and community places that do offer smoking cessation courses. Okay, so while we're laying in bed, it's common for your bowels and your belly to kind of slow down, because it's not getting much movement. And also, if we're taking any analgesics for the pain as well, it's common that one of the side effects is constipation. So we do want to avoid constipation, because with everything else going on, that's the last thing that you want right now. So it's really important to increase your fluid intake, what we talked about, and also increase some fiber in your diet as well. So to avoid getting constipated, can you tell me what you need to increase in your diet? Fiber. Yes. Okay. So we did, when I was going over the assessment, you did talk about how you had a little bit of urgency, which is okay, but we also need to, I wanted to go over some possible ways to kind of avoid that, and to, get you on a normal voiding schedule. So there are things that we like to do. It's called bladder training, and just like a schedule where, maybe every 2 hours, whenever you're getting up to go on your walk, we could help you to the restroom before we do that, just so we kind of get on a normal schedule. And then for your muscles and everything like that, like I mentioned, laying in bed, it's really important that we do some range of motion exercises. Even if it's just moving yourself around and just like moving your legs back and forth. We really want to get that blood flowing, and we want to keep those muscles working. Can you explain to me what we need to do to kind of get your muscles up and working besides walking? If you're feeling really tired one day and you're just really out of breath, is there anything that you can do, just laying here in bed, that will kind of help that? Range of motion. Yes. Okay. So one last thing that I did want to talk to you about, it's really, really important, because patients who are in the hospital laying in bed, they are at a higher risk for having some skin breakdown. So it's really, really important that we get you on a turning schedule. So we want to move and reposition and turn around every couple of hours. So say 2 hours. That's really, really important. It prevents pressure ulcers. So can you explain to me one of the things that kind of prevents skin breakdown and pressure ulcers? Moving around and reposition yourself. Good. Okay. Alrighty.